Hey, we're standing here with Dr. Gannuch, a sleep disorder specialist here in Huntsville, and he's going to kind of walk us through some of the warning signs and symptoms of possible sleep disorders, and we'll talk about if you think that you possibly have a sleep disorder, the steps you'll need to go through to get it analyzed and hopefully get it fixed. So what are some of the major warning signs that people should look for, or their spouses should look for?
Yeah, probably the biggest thing we see in the lab is obstructive sleep apnea. And, the classic symptoms of obstructive sleep apnea, one being very tired during the day, just not feeling refreshed when you wake up in the morning, maybe having to take naps to help get you through the day, falling asleep watching TV, that kind of thing. At night, frequently the person with sleep apnea is snoring. The wife will notice that maybe there's pauses in their breathing. Sometimes the patient will tell me that they wake up in the middle of the night gasping and choking. Those are kind of the classic symptoms of obstructive sleep apnea. And if any of that's going on, there's serious cardiovascular problems that can go with it. We know it can cause high blood pressure, heart attacks, strokes, arrhythmias, very treatable condition too.
And like with myself, it seems that I've had many of those symptoms, but they've been slow to progress over several years, and it just didn't, click one day. Hey, I may have a problem sleeping. It was a culmination of all these events and trying to figure out why do I feel sluggish during the day? Why am I sleeping 8 hours but not feeling rested? Do you see that often where it's taken a long period of time to slowly build?
Yes, it's difficult. Probably the main cause of obstructive sleep apnea for most people is weight gain. And as you know, that slowly happens over time. You slowly start putting more pressure maybe on your lower airway. Some people will have big tonsils or some kind of obstructive, airway from soft palate or something. But typically, it's more common as we get older, certainly more common in males, and then as you gain weight. So, a lot of those things just happen slowly over time. So, yeah, that's the typical way it presents.
And then if somebody thinks they have a sleep disorder, sort of step one is to come see Dr. Gannuch or a sleep disorder specialist, or I guess get a referral from their family physician. Mm-hmm. And then this is kind of step one. You come in, you kind of talk about your symptoms that you're having, and then where typically does it go from there?
Yeah, basically you come into the clinic and we'll kind of go over your sleep history, do a quick physical, and then if it looks like you have signs and symptoms of sleep apnea, then we'll have you stay overnight and we'll do what we call a nocturnal polysomnogram, which is a study where we can look at a whole bunch of variables, typically, monitoring your heart, your respirations, and we'll know if you have sleep apnea, if you're having these blockages, these obstructions throughout the night. So you stay overnight in the lab, and then you come back usually in the clinic about a week later. I go over the results, and then we can move on from there for treatment options.
Okay, great. We'll check out the lab.